All righty, Dr. White, good to have you back in action. Even though you live across the street from us, we never see you. Saw you on your road the other morning.
Neighbor.
Yep.
Walking around.
In your robe.
Oh, sure.
Oh.
I was naked,
Absolutely.
so I
Hey,
didn't want to
we're
come
a
over.
close-knit.
Yeah.
Close
Yeah, we're
knit.
close there. Yeah. All right, what's your subject today?
Well, it's polypharmacy. And polypharmacy...
Is that like a male
No.
pharmacy?
Polypharmacy means taking many drugs.
Taking too many drugs?
No, taking many drugs.
Oh, many.
Oh.
Now, it's not really a bad thing, but...
Taking a bunch of drugs is not a bad thing?
Well, yes, taking prescription drugs and taking 5 or more, you have more of a chance for side effects
Let me ask
and
you, when
interactions.
my dad was sick
Yeah.
before he died. He lived alone, and he had all these things to take. I
He
don't
had
know.
about 30 pill bottles.
Doesn't they counteract one another?
Yes, that's why this is dangerous. The more drugs you take, the more chance you have for drug interactions. And some of those are deadly interactions. Now, what we recommend is a brown bag review. Take all of your drugs, including herbal supplements, in a bag, take them to the pharmacist or your physician, and get a review. Most older adults
They have
do
more
not
than one
even know
doctor.
what their drugs are for, and sometimes we find that they're taking 2 or 3 of the same drug.
Whoa.
Different names. We have people falling, going to the emergency room. It's very serious.
And you know, they have so many different doctors, and they don't necessarily...
No one is,
through
it's
that
all
list.
fragmented. No one is coordinating this.
Right.
So this is on the increase, not only because there's more older adults, because there are more people now taking prescription drugs now that we have Part D Medicare.
Right.
And now we had these new controversial guidelines for statin drugs, so more people are on those drugs. But it's very dangerous when people on their own decide, well, I'm just going to throw in some ginkgo because, you know, I hear that it makes memory better, but it also acts as a blood thinner. So if that individual is taking Plavix or some other kind of blood thinner, then you're setting yourself up for a very dangerous situation. So the brown bag review is what makes the most sense.
Well, why do most people, older people, and maybe it's just
Scare
mindset or
tactics.
whatever, they think they've got to have every one of those at the exact time every day when you know that's probably not right?
Well, they're trying to comply and they're trying to manage, but when you get 5 or more drugs, really, it's very difficult to manage.
Keep up with it.
It is. So you have to have a professional look at those drugs. And you know, a lot of older adults are over-medicated.
And they use, they
Yeah,
have pill
a bunch
boxes.
of them.
Yeah, a bunch of them.
And
And
they have pill boxes that you can take in the morning, lunch, and dinner, too. So there's ways to organize it if you're
Right.
not taking too many.
Right, and some people need supervision
Yeah.
with taking their medications, so it's something that we need to be mindful of. Many drugs have side effects such as causing dizziness, and then you're throwing in other things, and then you have a fall, and then, you know, there you go, slippery
Isn't
slope.
it a waste of money, too? You said that some of them may be taking
Oh,
2 of
yeah.
the same type
Oh,
pill.
2 or 3 of the same.
A
So,
lot of drugs are
yeah,
going up like 1,000%.
I know
aren't
it.
Tremendously.
they?
Yep,
Just because they can get away with it.
right, yep. So do the brown bag review, that makes the most sense, and
And what'd you call it,
And live
polyamory?
longer.
polypharmacy.
Polypharmacy.
It means taking 5 or more drugs. And when you, the 5 seems to be the threshold because after you, when you start taking more than 5, it gets harder to manage. And most of these drugs are for
sense.
chronic conditions that you take all the time.
And I think most importantly, too, make sure how they counteract each other.
Absolutely. And see, that's where you need professional guidance. You need the guidance of a pharmacist
Right.
or a
And the pharmacist will
physician.
do that for you.
Oh, yeah.
You need to ask. Some pharmacists do not have time for that, so I would
they're all
call
busy.
and
I'd find one that had
ask.
time. I mean, you need a good
Absolutely.
pharmacist.
And take all of them, include all of your herbal supplements and your vitamins.
Joseph, you went up to Knoxville over the weekend?
Friday
about
I
it.
went to Knoxville. Well, it was
4-hour drive and a 20-minute read?
about a 3-hour and 45-minute drive. I was on the ground 25 minutes.
Were you
I mean,
nervous?
you walk in, you sign in. You know what?
Are there
I
people
was a
sitting
little
out? Are
nervous.
there people sitting out there too?
Yeah.
Going
You're
for the
checking
same
everybody
part?
out, thinking,
Well,
oh, man,
you know,
They
I'm
said,
not
look at that
gonna
dude
get
that's
it.
coming in.
I didn't see anybody that looked exactly like me. There was like a 15-year-old kid, a young boy, an older woman with white hair. There was a heavy-set guy that had crazy hair. So I didn't see anybody that I seemed to be in direct competition with.
Hey.
Anyway, what was that? I missed it.
Crazy hair.
Oh, crazy hair. But I was nervous. I don't know why. It was a little bit, the room threw me a little bit, and maybe the grandeur, I guess,
Yeah.
of the moment, because that was the first time I had gone off to audition for a speaking role in a big feature film.
yeah.
I mean, everything's been kind of small or background work for me.
Did you read well? Did you do good?
Well, I don't think it was my best, but you know, I talked to Danny, and he said, dude, there's been ones where I've come out and said, yes, I nailed it, then I don't hear a
Didn't get it.
word.
Yeah.
Let's give a shout out to your mentor.